According to the American Diabetes Association, 25.8 million Americans in 2011 live with diabetes. Dr. Ralph A. DeFranzo is professor of medicine and chief of the Diabetes Division of the University of Texas Health Science Center in San Antonio and serves as deputy chief of the Texas Diabetes Institute there.
The American Diabetes Association has set an A1C goal of 7. The American Association of Clinical Endocrinologists has a lower goal at 6.5. Half of our patients in the United States are not at these goals.
Although the precise mechanism of action is unknown, it's believed that diabetic patients have low central nervous system dopamine levels, particularly in the morning.
Cyclocet is an oral hypoglycemic agent that's been approved by the Food and Drug Administration for the treatment of adult type 2 diabetic patients. It's believed to work by altering the levels of dopamine and serotonin in the brain, in specific parts of the brain, in the area of the hypothalamus. And by altering the levels of dopamine, this leads to an improvement in insulin sensitivity in liver, and particularly a decrease in the postprandial or the post-meal glucose level, leading to a reduction in A1C that's in the range of 0.6 to 0.8. Cyclocet can be added to anti-diabetic agents that are currently approved by the Food and Drug Administration.
Treatment of type 2 diabetes is a difficult problem because patients have many complicating disorders.
The needs are medications which combine improved glycemic control, a demonstrated cardiovascular safety profile, and no weight gain. Following 24 weeks of monotherapy, once daily dosing of Cyclocet significantly reduced postprandial glucose levels in patients with inadequate glycemic control following breakfast, lunch, dinner, without any increase in the plasma insulin concentration. Following 24 weeks of therapy in combination with one or more oral anti-diabetic agents, Cyclocet provided a reduction in A1C that's in the range of 0.6 to 0.8 compared to placebo in patients with inadequate glycemic control. As observed in a 52-week placebo-controlled trial with 3,070 patients, Cyclocet has a demonstrated cardiovascular safety profile. In clinical trials, no significant weight gain was observed with Cyclocet versus placebo. Cyclocet is a drug which is given upon awakening in the morning, and it increases the dopamine levels within the central nervous system, particularly in certain regions of the hypothalamus. And it's believed by increasing the dopamine levels, this leads to an improvement in insulin sensitivity in peripheral tissues, particularly in liver. And the result is a decrease in the post-meal and the postprandial glucose concentration, which in large part explains the 0.6 to 0.8 reduction in A1C that we see with this drug. Cyclocet also can be added to other oral anti-diabetic drugs. When investigators analyzed 52-week data in patients who had been taking TZDs with or without other oral anti-diabetic drugs and who were not at A1C, baseline A1C goal greater than 7.5%, they found that adding Cyclocet reduced A1C by 0.91% versus placebo. Please note that efficacy data in combination with TZDs are limited. As A1C is above goal, Cyclocet may help drop his or her A1C to 7% or lower so that the glycemic control goal is achieved.
Patients with type 2 diabetes are at an increased risk for cardiovascular disease, stroke, myocardial infarction, sudden death, and angina versus non-diabetic individuals.
More than 70% of type 2 diabetic patients will die due to cardiovascular causes. Cyclocet has a demonstrated cardiovascular safety profile. In a large 3,070 patient, 52-week safety study, Cyclocet's use was not associated with an increased risk for adverse cardiovascular events. There was a 42% relative risk reduction for the composite cardiovascular disease endpoint versus placebo, with a hazard ratio of 0.58. 1.5% of patients on Cyclocet versus 3% of individuals on placebo experienced the composite cardiovascular disease endpoint. There was a 55% relative risk reduction for major adverse cardiovascular events in particular the MACE endpoint, versus placebo with a hazard ratio of 0.45. 0.5% of cycloset patients versus 1.4% of patients on placebo experienced a myocardial infarction, stroke, or cardiovascular-associated death. There have been no clinical studies establishing conclusive evidence of macrovascular risk reduction with cycloset or any other anti-diabetic drug. Cycloset does not increase the risk of macrovascular events.
Cycloset has a safety profile comparable to placebo.
8.5% of cycloset-treated patients had a serious adverse event compared to 9.6% of placebo patients. Nausea was the most common side effect and was usually experienced during the titration period. It was generally transient and experienced during the initial titration period, lasting less than 2 weeks. In clinical studies, patients taking cycloset had no significant weight gain compared with placebo. There was no severe hypoglycemia compared with placebo. So the drug cycloset should be given within 2 hours of awakening. As close to awakening as possible is even better. We start with 0.8 milligrams, and at the end of a week, if the drug is tolerated, we then double the dose to 1.6. Another week later, we add another 0.8. We go to 2.4, and so forth. And the idea is to get up to 4.8 milligrams. In clinical trials, most patients reach a dose between 3.2 and 4.8 milligrams, or 4 to 6 tablets per day.
It's important for the doctor to explain to the patient that they may experience nausea. It shouldn't come as a surprise to the patient.
In my opinion, I think really the drug cycloset can be used in diabetic patients who need an additional drop in A1C that's in the range of 0.6 to 0.8.
Cycloset is indicated as an adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes. Cycloset is taken once daily within 2 hours of waking in the morning. The initial dose is 1 0.8 milligram tablet daily, titrated weekly by 1 tablet until therapeutic dose 1.6 milligram to 4.8 milligram, or between 2 to 6 tablets per day, is achieved. In clinical trials, most patients reached a dose between 3.2 milligrams and 4.8 milligrams, 4 to 6 tablets per day. Cycloset should not be taken by patients who take ergo medicines. A healthcare provider or pharmacist can provide a list of these medications. Cycloset should not be taken by anyone who is allergic to bromocriptine or any other ingredient of cycloset. Patients with syncopal or fainting migraine headaches should not take cycloset because it may cause very low blood pressure. Women who are breastfeeding should not take cycloset. It may prevent them from producing milk. Some breastfeeding women taking bromocriptine, the active ingredient in cycloset, have had strokes. For additional safety information, please read the remaining important safety information. Click on the link below to the full prescribing information.